In this video, I'll be demonstrating on how to insert a nasogastric tube. The first thing you want to do is verify that the patient is getting an NG tube put in by looking at the doctor's orders. Then you want to have the patient verified by asking them their name and date of birth. You can also ask if they would like a topical anesthetic or lidocaine spray for nares, because some people find that helpful. First, what you want to do is you want to clean off your table and gather your supplies. So I have here my nasogastric tube, I have a waterproof pad, I have some lubricant, I have my pH measure here, a syringe, I have a marker, I have my roller, an emesis basin, and I also have some tissues, and my cup of water with a straw. After you have your supplies together, you're going to have the patient occlude each nostril, and the nostril they can breathe easier out of is the one that we're going to use to insert the tube. So you're going to take your nasogastric tube, and you're going to measure from the tip of the nose to the earlobe. From the earlobe, you're going to measure to the xiphoid process, and from there, you're going to take your measuring tape or ruler, and you're going to measure 5 inches. And then with your marker, make a note of where that is. And this will ensure proper placement for after you insert the tube and you know what to look for. Okay. So, I'm going to put on some gloves. I'm going to take out a test strip for when I'm ready. I'm going to take some lubricant and put it here. And then I'm going to lubricate 2 to 4 inches of the nasogastric tube. Once your tube is lubricated, you're going to have the patient tilt their head back slightly, and then you're going to insert the tube upward and back along the floor of the nose. And then when you feel resistance, it means that you got to the back of the nasopharynx. And the patient might gag a little when it gets to the back of their throat. At this point, you're going to have the patient bend their chin down to their chest. And as they're drinking water, you're going to advance the tube downward and backward when the patient follows. You don't want to force the tube. You can rotate the tube if you meet resistance, and if the patient is gagging or coughing, check placement with a tongue depressor and a pen light. And then you want to make sure that you insert the tube to the marking. Once you got your tube to where the marking is, you want to secure it loosely with some tape. And this will help you check it for placement. So to check for placement, you want to check the pH to make sure the tube is in the stomach. Gastric fluid can be green with particles or brown if old blood is present. The pH should be less than 5.5. You want to insert your syringe into the nasogastric tube and aspirate a small amount of fluid. You don't need a lot. And you want to make sure you kink off the tube so excess gastric fluid doesn't come out. Then you want to take your fluid and put a drop on your paper here. And then you want to match it up to your indicator. And this confirms that the tube is in fact in the stomach. A small amount of blood would be normal immediately following insertion. At this point, once placement is confirmed, you can now irrigate the tube with 30 milliliters of sterile saline and gently flush it. Like so. And this flushing of the nasogastric tube helps to loosen secretions and make them not as thick. Make it so they are able to be suctioned out easier. And finally, you want to attach your tube to suction and monitor the color, odor, consistency, and amount of drainage.